The scenes and stories coming out of India grow more heart-wrenching each day. At overflowing hospitals, COVID-19 victims are dying in front of locked gates. Doctors and nurses are making hourly decisions about which humans deserve a chance to live off an agonizingly short supply of drugs and oxygen. Crematoriums are running 24 hours a day, unable to keep pace with demand. Bodies are being burned each night in parking lots. By the coming dawn, the asphalt is caked in ash and bone. None of these horrific images seemed possible even 2 months ago. And it's terrifying to think how close the United States came to sharing a similar fate. India surprised scientists, at firstRewind to spring of 2020. Researchers already knew that the SARS-CoV-2 virus spread rapidly when large groups of people gathered in close proximity. For this reason, epidemiologists worried that India, a country of 1.4 billion people, would get the worst of it. They feared the country's congested and impoverished cities would act as cauldrons for viral transmission. They were wrong. At least, at first. For most of 2020, India's municipalities maintained a relatively low incidence of COVID-19 infection and death. Scientists couldn't be sure why, exactly. Theories revolved around the nation's relatively low obesity rate, especially compared to the United States, where obesity and diabetes proved to be key drivers of COVID-19 hospitalizations. There was also speculation that India's tight living quarters might have produced millions of subclinical infections, creating a mild natural immunity. Then things took a turn, and then another fast forward a few frames to fall 2020. Following a sudden COVID-19 spike in which India saw its daily case count shoot up to 90,000 plus, much of the nation shut down. The decision proved economically brutal but medically shrewd. Many unemployed workers moved out of cities and into the surrounding farmlands. As people spread out, India's case count stabilized. By the new year, India's daily infection count was under 20,000. The United States, by contrast, was getting blasted by the virus. Owing to holiday gatherings and pandemic fatigue, U.S. daily infections soon topped 250,000. Taking population into account, the rate of infection in the United States was 40 times higher than in India. This teeter-tottering of nations in crisis might have continued indefinitely if not for one pandemic-altering event. While nations like New Zealand, South Korea and Singapore were instituting rigorous shutdowns, implementing invasive contact tracing strategies, and imposing mandatory quarantines, the United States took an entirely different tack. As those nations doubled down on slowing the spread, American leaders pushed all their chips to the middle of the table, betting everything on a vaccine. By summer 2020, funds earmarked for the CDC and protective medical gear had been diverted toward an all-out vaccine blitz called Operation Warp Speed, OWS. By August, the